In evidence-based medicine, the choice between normal saline and Ringer's lactate for irrigation during abdominal surgery depends on the specific clinical context. Here's a comparison of the two. 1. Normal saline, 0.9% sodium chloride. Composition: a sterile, isotonic solution containing sodium and chloride ions. Advantages: neutral pH, has a pH of around 5.5, which can be considered neutral enough for many surgical situations. Common use: widely used for general surgical irrigation due to its availability and simplicity. Compatibility: generally compatible with most tissues and does not significantly disrupt the electrolyte balance when used in large quantities. Considerations: hyperchloremic acidosis. Large volumes can lead to hyperchloremic metabolic acidosis due to its chloride content, though this is more of a concern with intravenous administration than irrigation. Irritating to tissues. In some cases, normal saline can be slightly more irritating to tissues compared to balanced solutions like Ringer's lactate. 2. Ringer's lactate, lactated Ringer's. Composition: a balanced electrolyte solution containing sodium, potassium, calcium, chloride, and lactate, which acts as a buffer. Advantages: balanced electrolytes. More closely resembles the body's plasma, making it less likely to cause electrolyte disturbances. Buffering effect: the lactate in Ringer's solution is metabolized to bicarbonate, which can help maintain acid-base balance, reducing the risk of acidosis. Less irritating: generally less irritating to tissues than saline, making it a good option for sensitive areas or prolonged irrigation. Considerations: calcium content. The presence of calcium in Ringer's can potentially interact with certain medications or blood products, although this is less relevant for irrigation. Not always necessary. For shorter routine procedures, the benefits of Ringer's lactate over saline may not justify the additional cost or preparation complexity. Evidence-based recommendations. Routine use. Both normal saline and Ringer's lactate are considered safe and effective for abdominal irrigation during surgery. Preferred solution. Ringer's lactate is often preferred in situations where large volumes of irrigation fluid are needed, or where maintaining a balanced electrolyte environment is critical. Normal saline may be preferred for simpler or shorter procedures where electrolyte imbalances are less of a concern. Conclusion: there is no clear-cut answer, and both solutions are used effectively depending on the clinical context. However, Ringer's lactate is often favored for its balanced composition and buffering capacity, especially in more complex or prolonged surgeries. If there are no specific contraindications, it may be preferred over normal saline for abdominal irrigation during surgery.